over 800 delegates from around the globe gathered in Dar es Salaam, Tanzania from April 6 to 8 for the WomenLift Health Global Conference 2024. Together, they amplified the call for a more equitable and inclusive healthcare landscape, starting with a brief history of WomenLift.
Asked me to give a little bit of the history of WomenLift Health. Since 2016, where I was at a MEPI conference in Nairobi, and I'm sitting in this conference where all the medical deans of Africa are assembled, and I looked at the table and it was all male, and I'm talking about, I think there were 10 or 12 men. And I looked at this and I said, what is wrong with this picture? That mantle, what I called a mantle, really reflected the imbalance that I saw in the United States, well, in Africa. But this history is why it's a delight to be with you today, celebrating. This is really the first in-person conference because the annual conferences became virtual during COVID-19. It was felt very critical to provide some support, community, and mentorship during that time, which so dramatically underscored what we already knew. We need women in positions of power, and I'm looking at Helen Clark. We need those women in positions of power, because if you looked at the countries that did well with COVID-19, it was all countries that were led by women at the beginning. And I hope you found it to be more than a conference, more than that professional armor that Margaret described, but really a place to push, a safe place to push beyond the traditional discourse that we have usually in these conferences, and really serve as a catalyst for careers, for mentoring, a hub for really gender equality. And hopefully we're going to see it as a platform for systemic institutional change. That's our next goal.
To advance the founding principles of WomenLift Health, the conference brought together public and private sectors, global foundations, and government leaders. Their collective goal to deepen the dialogue on the vital role of women in healthcare.
Your Excellency, Dr. Philip Isidore Mpango, the Vice President of the United Republic of Tanzania, Honorable Dr. Jakaya Mrisho Kikwete, retired President of the United Republic of Tanzania, the Right Honorable Helen Clark, retired Prime Minister of New Zealand. I would like also to acknowledge the presence of Dr. Rebecca Moeti, WHO Director, Regional Director for Africa, Dr. Anita Zaidi, the President of Gender Equality Division, Bill and Gates Foundation, Ami Batson, President of WomenLift Health, Permanent Secretary, Minister of Health, Permanent Secretary, Community Development, Gender, Elderly and Children, distinguished delegates, ladies and gentlemen, habari ya asubuhi. You are in Tanzania. Good morning. Allow me to take this opportunity to thank the Vice President of the United Republic of Tanzania, Dr. Philip Isidore Mpango, for accepting our invitation to officiate this important conference, WomenLift Health Global Conference 2024. Mheshimiwa Makamu wa Rais, tunakushukuru sana. Tunajua una majukumu mengi, but you have accepted our invitation to officiate this important conference. It does also signify the commitment of the government of United Republic of Tanzania to advance women rights and gender equality issues within Tanzania and outside Tanzania. Distinguished delegates, let me also take this opportunity to welcome all delegates who have traveled long distances from various continents. We have had our Permanent Secretary and across the globe just to make sure they attend this conference. This is your second home. Karibuni sana. You are warmly welcome.
This conference is taking place at a critical moment when the world continues to grapple with geopolitical tensions and conflicts, climate crisis, stubborn diseases and health pandemic risks, food insecurity and malnutrition, economic headwinds, as well as rapid technological advancement and related threats and opportunities. I therefore commend the organizers of this conference on the choice of the theme, which, as we heard, is reimagining leadership, new approaches to new challenges. Ladies and gentlemen, humanity today is facing many global health challenges, with the greatest adverse impacts falling on low and middle income countries. Tanzania under President Dr. Samia Suluhu Hassan provides clear examples of women-engineered priorities and innovative leadership in addressing global health challenges. Excellencies, ladies and gentlemen, I would like to assert with confidence that the milestones I have just highlighted have been reached largely on account of the staunch leadership and eyesight of a woman leader at the very top. To conclude, I wish to take this opportunity to reiterate the commitment of the government of the United Republic of Tanzania to work with WomenLift Health Global and other stakeholders to continue to advance and promote women in health leadership positions.
Something that I've heard said several times today, and which I will repeat, is that health is led by men and done by women. So we have a 25-70% divide between women leadership, 25%, women working in health, mainly at the lower levels, 70%. So that's really the statistics that makes it absolutely imperative that we change, we shift. The other thing that I'd like to say is that if we look at providing healthcare and caregiving, most of the caregiving that's informal in the home, unpaid, is done by women. So not only do women do the bulk of the caregiving that's in the formal paid health sector, but they do that in families as well. So the objective of this conference and of this initiative is to make sure that those who are doing the work also lead the work, meaning we know that women have got leadership capacity. So the idea is to unleash that, is to find ways for women to believe in themselves and also to support women to gain the skills that they need in order not only to believe themselves, but to be able to demonstrate and to deliver in the way that we have seen women deliver when they emerge from the program. There's a mentorship program that WomenLift is running. And that's something that can be modeled, carried out in countries all over Africa, all over the world. And it needs to be something that's part of national policies. So if I'm a president and I want to improve the health of my population, I'll be very concerned about the fact that women, there are so few women leaders in health, in the system, in countries. And I would like to invest in these women so that we benefit as a country from their skills, from their leadership skills, and from their massive experience as caregivers. Nobody understands caregiving more than the people who are doing it 24/7.
And among the distinguished experts at the conference, Doris Mollel emphasized the importance of leveraging technology and innovation in healthcare. She showcased a homegrown neonatal machine as a prime example of this transformative approach.
These equipments are going to support our hospitals, specifically dispensaries and health centers. Why? That's where the majority starts from. Yeah. So this machine is produced at a cost of 600 USD. It's a warmer, it's a phototherapy machine, but it's also tied with weighing scale. It's like you can weigh a baby. So as you treat jaundice, you give worm, but you also get to see the weight, and you also get to measure the temperature of a baby. Looking into the phototherapy machines that I normally buy through our foundation. So you'd buy phototherapy costing about 1,500 USD. Coming to buy a baby warmer that would cost you 2,000 USD. A weighing scale costing you about 200 USD. So all that, you get it in one at 600. So
and it's locally
made here.
Yeah.
And it's something that we can continue producing here in Tanzania when we get if we get enough muscles to do so.
Most of the public health facilities and private health facilities are having a shortage of almost 60% of skilled health workers. So it means we're just working with about 40% of what is really required. However, this is something that has been going on for quite some time, so it's a chronic shortage that we've had, and it's not very different from other African countries, I would say. So we came up, the Mkapa Foundation came up with innovative strategies to fill that gap, but with a special agreement with the government that we will deploy them for like 2 years, and then after that they will be absorbed in the normal employment system of the government.
This is why we started the Women Fund Tanzania Trust 15 years ago, basically in realization of that women need a funding mechanism which are not necessarily only for business rights, for any right. So our organization started with an objective of saying we need to bring more funding to women, especially at the grassroots level. We needed to bring more funding to women so that they can push out the agenda they are working with, but we also need to bring a funding mechanism that somehow tries to challenge the mainstream philanthropic or the government funding.
From innovation and technology to workforce gaps and finance, the WomenLift Health Conference 2024 delved into a spectrum of critical issues across 3 dynamic days, featuring workshops, seminars, discussions and more, leaving attendees inspired to foster a more inclusive, equitable and responsible health system worldwide.
First, it's a privilege to be here. We appreciate networks such as WomenLift Health for creating the networks for women to exercise leadership in the health space.
Thanks to everyone's hard work, I know that I'm walking away with a stronger understanding of what transformative leadership looks like, sounds like, and acts like. And I really look forward to continuing on this leadership journey with all of you. And watch as each and every one of you discovers your own best way of being a leader and a woman.